What was your most memorable experience while you were president of the ASDS?
My most memorable experience serving as president of the ASDS was working through the issues surrounding the board examination in Mohs micrographic surgery, which has eventually come to pass 10 years later.
What were the most pressing issues at that time that faced the society?
The main issue facing the society during my presidency was Mohs micrographic surgery, whether there should be a board examination, and then the rules governing which lesions should be appropriate for Mohs micrographic surgery, which led to the appropriate use criteria which are in place today.
What were the most significant innovations that were going on within the dermatologic surgery?
The most significant innovations in dermatology during my presidency, which was from 2009 to 2013, were basically the invention of the Fraxel laser and the multiple types of hyaluronic acid that were produced by many different companies.
And in your career, do you have a most memorable patient that you can think of?
My most memorable patient was a patient I had that had a small squamous cell carcinoma beginning on the nose, which traveled down a nerve going into the maxillary sinus, through the piriform aperture and then into the brain, whom we took to the operating room and did a neurosurgical operation that eventually cured the patient, just as the lesion got to the brain, basically.
If you look back on your career, would there be anything that you would change?
I think the one thing I would change is I would probably have written more papers and more books, but unfortunately, patients take such a great amount of our energy. It's very, very difficult to do that as well as see patients. One of my favorite sayings is, if it weren't for the patients, we could get some work done.
And what advice would you give today's young dermatologic surgeons?
Well, if you're a young dermatologic surgeon, I think you need to pay careful attention and just taking good care of the patients and keeping your eye on that particular aspect of your career, and not to be too dissuaded by the money aspects and other things that you may not be particularly interested in. Just keep your eye on that ball and don't let administrators take over medicine.
Do you have any predictions for the future of the ASDS?
Well, I think the specialty is evolving in the direction of dermatologists doing more complex work, for instance, Mohs micrographic surgery and cosmetic work, whereas general dermatology seems to have gone by the wayside and has been handled by physician extenders at this point, which is sort of a sad goodbye to general dermatology, but I think that's probably what's going to happen in the future.
So what advice do you have for the ASDS leadership in serving its membership in the future?
I think the ASDS needs to focus on supporting dermatologists in the two roles that I mentioned previously, which is the role of doing these complex procedures, mostly with Mohs micrographic surgery and reconstructions, and then the second big thing that the dermatologists would do would be to be innovators in cosmetic dermatology, particularly in the fields of fillers and lasers and Botox.